Welcome to The Explainer. I am absolutely thrilled you're joining me today because we're looking at something incredibly powerful for anyone working on the front lines of care. If you're a clinician, a pastor, a first responder, or a lay counselor, well, you know exactly how heavy it is when a client or a loved one experiences a devastating, sudden event. It's a lot to carry, right? Today we're exploring an elegant and deeply effective protocol developed by Dr. Denise Colson as part of her strategic trauma and abuse recovery system. It's called the lend-a-hand method, and its primary goal is honestly remarkable. We're talking about stopping trauma in its tracks before it even has the chance to take root.
Okay, let's dive into this. We really have to ask ourselves, can we actually prevent a single trauma from becoming a lifelong identity? This gets right to the high-stakes reality of crisis work. When someone goes through a terrifying one-time incident, much like Dr. Colson herself, who actually survived an assault at knife point, there's this incredibly critical opportunity for intervention. We aren't just talking about long-term therapy here. We're talking about a very specific type of near-term intervention that acts, well, kind of like a circuit breaker for the brain.
You see, we are working against a critical ticking clock. At day zero, the traumatic incident happens. Then, we immediately enter what Dr. Colson identifies as the ideal intervention window, which is roughly those first 6 months. Now, this window can sometimes stretch up to 12 months, but the core idea here is that we have a strictly limited amount of time to address this source of trauma before the damage really starts to compound. If we can step in and use the right structured approach during this specific time frame, we can literally prevent a cascade of additional, devastating losses for that individual.
Because think about it. If we miss this 6 to 12-month window, the victim risks adopting a permanent trauma survivor identity. When the trauma is left unresolved in the near term, it doesn't just go away. It grows, it solidifies, and once someone fully internalizes this trauma survivor identity, recovering from it requires a much longer and way more complex grieving and reintegration process. By acting swiftly in the near term, we're literally saving people from spending years or honestly even decades having their entire identity defined by their absolute worst day.
Now, what's really interesting about this dynamic is how it applies directly to you, the caregivers and the crisis managers tuning in. When you're dealing with trauma day in and day out, you're essentially forced to navigate two entirely different versions of yourself. On one side, we have your professional identity. This side of you is highly trained to expect horrific events, right? It absorbs the shock, and outwardly it appears completely unaffected. But on the other side is your personal identity. This is who you were born as, it's God-given, it's rooted in your deepest core values, your beliefs, and your basic expectations of how people should treat one another. And because you value people, this personal side is deeply vulnerable to loss.
And this brings us to a really heavy burden that I know so many of you carry. As Dr. Colson perfectly puts it, as a crisis manager, you wear that identity 24 hours a day. When you hear a horrific story from a victim or deal with a perpetrator, your professional shield immediately goes up. The temptation is always to hide behind that professional role, to talk like a counselor or act like a pastor. But doing so actually eclipses your personal identity, hiding the very real emotional damage and the vicarious trauma that's quietly chipping away at your own core values. To prove just how true this is, Dr. Colson shares an incredible anecdote that absolutely nails this reality. Let's call it the Disney World effect. She talks about being on vacation, supposedly totally off the clock, at the most magical place on Earth, Disney World. And right there in the park, she had to suddenly shift into professional mode to break up a physical fight using her counseling skills to help a young woman who was completely losing it. It just proves that in this line of work, the job never truly stops. You are quite literally always on call.
So, knowing the immense pressure on both the client and the counselor, how do we actually intervene effectively? Well, first, we have to overcome a major hurdle. When traumatized people seek help, their brain's most common survival response is distraction. Without a highly structured tool, clients will fall into what's known as the round-robin defense. They come in one week saying, here's the problem. Then the next week they say, oh, actually no, I'm over that. Here is the real problem. They're constantly shifting from one story to another. They're venting, for sure, but they are absolutely not resolving the core issue. And that is exactly why a focused, structured tool is absolutely necessary. Enter the elegant simplicity of the 5-finger lend-a-hand method. Dr. Colson designed this to be instantly memorable by using, you guessed it, the 5 fingers of your hand as a structural map. This method acts kind of like blinders on a horse, keeping the client completely focused on a single story. You guide them step by step, safely bypassing their psychological defenses, keeping them right on track and entirely preventing that round-robin distraction we just talked about.
To show you just how effective this is, Dr. Colson's training actually includes an incredibly powerful role-play session with a client named Melissa. Just by adhering strictly to this structured protocol, asking very targeted questions about what happened and what core values were violated, Melissa is safely guided to draw out these deep, hidden feelings. Listen to Melissa's exact words from the session. "I was shocked, confused, angry, bitter, hurt." The structure creates this safe container that allows those profound feelings of betrayal and broken trust to surface, so they can actually be dealt with once and for all.
But here's where the magic really happens. A key mechanism of this method is moving the individual from the past directly into the present. You aren't just letting them recount historical facts about what happened back then. You are constantly drawing them back by asking, "What are you feeling right now as we're talking about this?" This brilliantly shifts the victim from getting stuck in the past to actively processing their emotions in the present moment while they're seated right in front of you.
And this brilliantly illustrates just how adaptable this tool is across incredibly versatile environments. Yes, you can absolutely use this in formal weekly counseling sessions when a client is in crisis. But because it's so structured and easy to remember, it works beautifully outside the clinic too. You can use it during pastoral care at church altars. You can use it in peer supervision to help a colleague process the vicarious trauma of their professional identity. You can use it for informal lay coaching, resolving conflicts with your spouse, or, and this is amazing, as one of Dr. Colson's students literally did, in a conversation while waiting in a grocery store line.
The applications are honestly endless, which is why this protocol isn't just a nice-to-have, it is an essential intervention. Dr. Colson has put together a comprehensive 4-part online training where you can completely master the lend-a-hand protocol. The training is beautifully structured to first ground you in the core concepts, walk you through guided role plays, and then equip you with actionable strategies to deploy it immediately. You can find all the information to enroll over at traumaeducation.com. Mastering this structured system is an absolute investment, not just in protecting your clients from developing a lifelong trauma identity, but in protecting your own personal identity from the crushing weight of the crisis work you do every single day.
So, I want to leave you with this provocative thought. When a sudden, traumatic event strikes someone in your care, the clock starts ticking. That 6-month window of ideal intervention opens. When it does, will you be ready? Will you have the right tool in your hand to stop that trauma in its tracks, or will you be left just hoping for the best? Head over to traumaeducation.com right now, get equipped, and be the definitive guide your clients so desperately need during their most vulnerable moments. Thank you so much for joining me on this explainer, and please, keep up the incredible work you do out there.